I've always wondered how Americans understand and tolerate the fact that almost every other advanced industrial country and many countries beyond that group have in fact chosen to do much more in the way of a national funded healthcare system than the United States. What is that about?
Again, it's tremendously deep. I think, first of all, that our system, which has been in operation for close to 100 years of commodified medical care, has resulted in a profound conscious and unconscious universal fear and insecurity in the general population. All of us have no idea what's going to happen to us if something goes wrong. And there is an enormous stigma in something going wrong in our society. If you're sick or disabled in some way, that puts you in a whole different category of status in terms of caste relationships in the society. And I think that people in this country are so isolated, so alienated, so incapable of identifying with the commonwealth of their brothers and sisters, of the rest of us in society, that it cripples us from being able to challenge the barbarity of the commodity monetized system of illness and death in our society. It paralyzes people. People have no grasp. They have no confidence that they, as a solo individual in a solo society, can challenge the system. It's just unimaginable to them. And they feel that because something's wrong with them, that they have a legitimate basis of having to pay to get better. I mean, it's the profound disease in our society, is monetary dependency.
Tell me, did the pandemic change anything? Was that a horrible experience? And I don't mean to imply that it's over, since I understand that it isn't. But has the period since early 2020 changed anything in the balance of the struggle for and against a nationally funded universal health support system?
The impact of the pandemic is absolutely breathtaking. We lost, 1 million people or more. People lost their jobs, and with their jobs being lost, those of them that had medical coverage of some sort through their work lost all that. And so that exposed the enormity, first of all, of the lack of a competent, massive public health capacity to respond to a situation like that, because everything is commodified. And the public health system has been defunded since the 1980s. Since the Reagan administration, there's been a replacement of clinicians with administrators. And so you have a situation that's compounded. The illness essentially ravaged the general society and only magnified the inherent fear and insecurity that's already there. It exposed the fact that there was no ground of a well-organized, government-driven, publicly driven intervention system into the society. So it was an enormous rip open of the wound of the medical delivery system and of the fragility of healthcare.